The 2019 Tony Howarth Awards for Leadership in Health, Safety and Wellness. Category 1 winner is Pine Lodge Clinic.
The issues that we identified here was that challenging behaviour had been a long-standing issue at Pine Lodge Clinic. About 60% of our OH&S incident reports that have gone in were related to challenging behaviour, and it was a key risk for us.
And that really led me to do a deep dive into those incidences and find out, in the first case, why they were occurring and where they were occurring.
It was wonderful to watch her investigate this situation, not only identify the hotspots, but the root causes, so that a number of different solutions can be implemented to improve caregiver safety and consumer satisfaction.
Frontline caregivers and managers are really key to finding out what are the reasonable strategies to take in relation to those verbal aggression incidences and why they were occurring.
This is one of the most impressive things I think about the project, was the way that Amber approached this, the way that she did the incident analysis, the way that she spoke to so many caregivers involved.
Our HSRs have the ear to the ground in relation to what's happening within our environment, and our caregivers know what is required and what I suppose might create other issues within our environment in relation to verbal aggression.
Staff felt validated. We also appreciated the support of concerns which were addressed and actioned. So there was follow through, which was tremendous.
There was a lot of solutions that were implemented in this situation, and Amber was fantastic. She was steadfast and consistent with this. Our caregivers in consulting suites looked at the environment, looked at some safety glass around that not only provided a barrier but was aesthetically pleasing as well and wasn't confrontational to consumers. We looked at complaints management. We discussed with our medical advisory committee how we could address some of the issues that consumers had got. Worked with the caregivers to identify the need for some education and training for de-escalation and management of those situations, and making sure that our frontline caregivers have the skills that they required to be able to manage these effectively. We also looked at our community team and the risks that were posed by them being lone workers, and Amber was fantastic in identifying products and solutions and supporting caregivers to try all those.
I'm most proud of the reasonable way that we've gone about trying to create a solution or an approach, providing solutions that are focused on what our actual problems are, making sure that these strategies are appropriate for our workplace. And I'm really proud of the fact that we are enhancing the care of our patients here at Pine Lodge as well.
Congratulations, Pine Lodge Clinic, for your careful and considered approach to addressing the issue of verbal aggression in your service. The cumulative impact of repeated exposure to such treatment can be devastating, and your investigation into not only the impacts on caregivers but the reasons behind patient aggression has led to increased security and a safer environment for caregivers and patients alike, which is the ultimate outcome. Thank you for not only driving changes but also educating caregivers on key issues and risks so we can continue to improve our response to patient aggression and ensure the outcomes are beneficial for all involved. Your inclusive, transparent approach to improving safety in the workplace is to be commended.